You ever heard of anterior cutaneous nerve entrapment syndrome, or ACNES? Despite being a significant cause of chronic abdominal pain, ACNES is often overlooked in clinical practice. Many patients endure years of discomfort searching for answers that remain elusive. In this video, we'll explore what ACNES is, why it's frequently missed, and how recognizing it can change lives. We'll walk through its underlying mechanisms, clinical features, diagnostic strategies, and the latest treatment options. By the end, you'll understand why ACNES deserves a place in every clinician's differential diagnosis for abdominal pain. Anterior cutaneous nerve entrapment syndrome, or ACNES, is a condition where nerves supplying the abdominal wall become trapped as they pass through the muscles. This entrapment leads to persistent, localized pain that can be sharp, aching, or even radiating. Unfortunately, because its symptoms can mimic other abdominal issues, ACNES is often misdiagnosed or dismissed. Understanding ACNES is crucial for both patients and healthcare providers, as timely diagnosis can prevent unnecessary tests and prolonged suffering. Anterior cutaneous nerves are branches of the lower thoracic intercostal nerves, specifically from T7 to T12. These nerves travel through the rectus abdominis muscle and the anterior rectus sheath to supply sensation to the abdominal wall. When these nerves become compressed or irritated as they pass through these structures, pain develops. This anatomical pathway explains why the pain is often localized and why certain movements or pressure can worsen symptoms. CNES is frequently missed because its symptoms overlap with many other abdominal conditions, such as irritable bowel syndrome or hernias. Patients often undergo extensive testing, including blood work and imaging, which usually return normal results. This can lead to frustration for both patients and clinicians. The key to identifying ACNES lies in a thorough clinical evaluation and awareness of the syndrome's unique feature. Underlying mechanism of ACNES involves mechanical irritation or compression of the anterior cutaneous nerves. This can result from abdominal wall trauma, surgical scars, increased intra-abdominal pressure, or repetitive strain. The irritated nerve sends pain signals, leading to localized discomfort and sometimes referred pain. Understanding this pathophysiology helps guide both diagnosis and treatment, as interventions often target the nerve's entrapment site. Patients with ACNES typically report localized, sharp, or radiating pain in the abdominal wall. The pain often worsens with movement, exertion, or pressure on the affected area. Some may notice increased skin sensitivity or tenderness when the area is touched or pinched. Two important clinical signs are the positive pinch test and Carnot's sign, both of which help distinguish ACNES from other causes of abdominal pain. Diagnosing ACNES relies on a structured approach. After a detailed history and physical examination, clinicians look for signs like localized tenderness, positive Carnot's sign, and a positive pinch test. Diagnostic nerve blocks, where a local anesthetic is injected at the suspected site, can confirm the diagnosis if pain relief is achieved. This approach helps avoid unnecessary investigations and ensures targeted treatment. Initial management of ACNES often involves conservative measures. Patients are advised to avoid activities that worsen their pain and may benefit from physical therapy, stretching, and strengthening exercises. Systemic medications like NSAIDs, mild opioids, or neuropathic pain agents can be tried, but their effectiveness is often limited since the primary issue is mechanical nerve entrapment. Lifestyle changes play a supportive role in managing ACNES. Patients are encouraged to avoid positions and movements that trigger pain. Techniques such as directional cupping, active release, osteopathic manipulation, and instrument-assisted soft tissue mobilization can help reduce tension in the abdominal wall. Regular stretching and strengthening exercises may also prevent recurrence. When conservative treatments fail, interventional procedures become the mainstay. These include trigger point injections, nerve blocks, and radiofrequency ablation. Injections can be performed blindly or under ultrasound guidance, with the latter offering greater accuracy and safety. These interventions not only relieve pain but also help confirm the diagnosis. Trigger point injections involve injecting a local anesthetic, sometimes combined with a steroid, directly into the area of nerve entrapment. This can provide immediate and sometimes lasting pain relief. The procedure can be performed blindly, relying on anatomical landmarks, or with ultrasound guidance for increased precision. A positive response not only relieves pain but also confirms the diagnosis of ACNES. Ultrasound-guided injections have become increasingly popular for ACNES. By visualizing the abdominal wall structures in real time, clinicians can accurately target the nerve and minimize the risk of complications. Techniques like the transversus abdominis plane tap, block, or rectus sheath block are commonly used. These methods ensure the medication is delivered precisely where it's needed. For patients with recurrent or persistent pain, radiofrequency ablation, RFA, or pulsed radiofrequency can be considered. These procedures use heat or electrical pulses to disrupt pain signals from the affected nerve. While not as commonly used as injections, RFA has shown promising results in providing longer-term relief for some patients, potentially avoiding the need for surgery. When all other treatments fail, surgical intervention may be necessary. Anterior neurectomy, where the entrapped nerve is surgically removed, has demonstrated significant success in reducing pain and improving quality of life for many patients. However, not every patient benefits, and anatomical variations can affect outcomes. In some cases, secondary or posterior neurectomy may be required. CNES can present in various ways, as illustrated by several case reports. For example, a 55-year-old woman experienced recurring abdominal pain years after surgery, eventually finding relief through nerve blocks and radiofrequency treatment. Another case involved a young woman whose pain was linked to anxiety and muscle tension, successfully managed with trigger point injections. These cases highlight the importance of considering ACNES in patients with unexplained abdominal pain. Short-term relief from ACNES is often achieved with nerve blocks or trigger point injections. Many patients experience immediate and significant pain reduction, sometimes lasting several weeks or months. However, recurrence is possible and ongoing management may be needed. Early intervention can prevent chronic pain and improve daily functioning. Long-term outcomes for ACNES are promising, especially with interventional and surgical treatments. Studies show that radiofrequency ablation and neurectomy can provide sustained pain relief for many patients. Effective management not only reduces pain but also restores quality of life, allowing individuals to return to normal activities and work. Despite growing awareness, research on ACNES is limited by small study sizes and variability in diagnostic criteria. More large-scale, high-quality clinical trials are needed to establish standardized protocols for diagnosis and treatment. Until then, clinicians must rely on current evidence and clinical judgment to guide management. Raising awareness about ACNES among healthcare providers is crucial. Recognizing the syndrome can prevent unnecessary investigations and treatments for other conditions, reducing patient frustration and healthcare costs. Education and training on clinical signs and diagnostic techniques are key to improving outcomes. In summary, ACNES is best managed through a combination of conservative, interventional, and surgical approaches. Ultrasound-guided injections with local anesthetic and steroids are recommended as first-line treatment. For recurrent cases, radiofrequency ablation or surgical neurectomy may be necessary. Individualized care based on patient response ensures the best outcomes. CNES is a treatable but often overlooked cause of chronic abdominal pain. Accurate diagnosis through clinical evaluation and nerve blocks is essential. With the right combination of therapies, most patients can achieve significant pain relief and improved quality of life. If you or someone you know is struggling with unexplained abdominal pain, consider ACNES as a possible cause and seek expert evaluation.